Good afternoon, everyone. This is Dr. Ray McGaskey. I'm here with Jerica. We're going to be demonstrating today some of the tests we might do for lateral knee pain. Specifically, our pain is where, Jerica? Right down here. So we are a little bit distal to the femur on the lateral portion, right past the patella. One of the tests we're going to do for this area, we're suspicious of a few things. We might be suspicious maybe of fat pad irritation. We might be suspicious of lateral meniscus tear, but the test we're going to do right now is more specific to another situation called iliotibial band syndrome, iliotibial band friction syndrome. Seen often in runners, seen often in bikers, especially endurance or distance athletes. The thought process here is we have our iliotibial band. It's going to insert right at Gerdy's tubercle on the tibia. With leg movements, the iliotibial bands is making its attachment from the hip to Gerdy's tubercle, and as that knee goes into full flexion, the thought is that there's a friction rub between that iliotibial band and the lateral condyle of the femur. Other theorists say that it's the compression of the iliotibial band on the fat pad, on the soft tissue in between the lateral epicondyle and the iliotibial band, or the bursa. I'm not really sure which one it is, but one of the tests we're going to do for it, called iliotibial bands, for iliotibial bands, is called Noble's test. How we're going to do this is we're going to put the knee at 90 degrees. We are going to palpate the lateral condyle. And I apologize if I called it the lateral epicondyle. It's the lateral condyle of the femur. And we're going to go maybe about a ½ inch, maybe a centimeter or two up above it. We're going to palpate that area, and then we're going to have the patient extend that knee out, looking for palpatory tenderness in the region. What physically is happening here is this iliotibial band is rolling under my thumb as it moves its way upwards towards Gerdy's tubercle. In this case, we'd see a positive for Noble's test. Another way to perform this test is we can actually have the patient sit at the edge of the table, and you come around to this side. We can do it pretty much the same way. We again will find the lateral condyle, and we'll have the patient just extend the knee out. And that will cause pretty much the same reaction. Again, this is Noble's test. It would be indicative of the possibility of iliotibial band syndrome. In our next video, we'll demonstrate how we might treat iliotibial band syndrome in our office.